Facts about psoriasis. It is a long-lasting autoimmune disease characterized by patches of abnormal skin. These skin patches are typically red, or purple on some people with darker skin, dry, itchy, and scaly. Psoriasis varies in severity from small, localized patches to complete body coverage. Injury to the skin can trigger psoriatic skin changes at that spot, which is known as the Koebner phenomenon. There are 5 main types of psoriasis: plaque, guttate, inverse, pustular, and erythrodermic. Plaque psoriasis, also known as psoriasis vulgaris, makes up about 90% of cases. It typically presents as red patches with white scales on top. Areas of the body most commonly affected are the back of the forearms, shins, navel area, and scalp. Guttate psoriasis has drop-shaped lesions. Pustular psoriasis presents as small non-infectious pus-filled blisters. Inverse psoriasis forms red patches in skin folds. Erythrodermic psoriasis occurs when the rash becomes very widespread, and can develop from any of the other types. Fingernails and toenails are affected in most people with psoriasis at some point in time. This may include pits in the nails or changes in nail color. Psoriasis is generally thought to be a genetic disease that is triggered by environmental factors. If one twin has psoriasis, the other twin is 3 times more likely to be affected if the twins are identical than if they are non-identical. This suggests that genetic factors predispose to psoriasis. Symptoms often worsen during winter and with certain medications, such as beta blockers or NSAIDs. Infections and psychological stress can also play a role. Psoriasis is not contagious. The underlying mechanism involves the immune system reacting to skin cells. Diagnosis is typically based on the signs and symptoms. There is no cure for psoriasis, however, various treatments can help control the symptoms. These treatments include steroid creams, vitamin D3 cream, ultraviolet light, and immune system suppressing medications, such as methotrexate. About 75% of skin involvement improves with creams alone. The disease affects 2 to 4% of the population. Men and women are affected with equal frequency. The disease may begin at any age, but typically starts in adulthood. Psoriasis is associated with an increased risk of psoriatic arthritis, lymphomas, cardiovascular disease. Psoriasis triggers. Typically starts or worsens because of a trigger that you may be able to identify and avoid. Factors that may trigger psoriasis include infections, such as strep throat or skin infections. Injury to the skin, such as a cut or scrape, a bug bite, or a severe sunburn. Stress. Smoking. Heavy alcohol consumption. Vitamin D deficiency. Certain medications, including lithium, which is prescribed for bipolar disorder, high blood pressure medications such as beta blockers, antimalarial drugs, and iodides. Treatment. If a doctor confirms psoriasis, treatment will depend on the type and severity of the condition. The main options include medications and phototherapy. People with psoriasis should use emollients to keep the skin moisturized when taking other treatments. This precaution can help reduce the itching and irritation and may reduce the number of lesions or plaques that develop. Medications. A range of topical, oral, and injected medications is available for people with psoriasis. Some OTC remedies can help relieve the symptoms of very mild psoriasis. Coal tar, this can help soothe plaque psoriasis, itching, and lesions on the scalp, palms, and soles. People can use coal tar on its own or alongside another treatment. Hydrocortisone creams, these reduce inflammation and soothe itching. Salicylic acid, this can help reduce swelling and remove scales, often in people with scalp psoriasis. Anti-itch agents, these might include products containing calamine, hydrocortisone, camphor, or menthol. If you like the video, give it a thumbs up and share it with your friends. If you want more insights and tips, don't forget to subscribe and click the notification bell for updates.